Home Health Aide Unit 2. Interpretation of Medical and Social Needs of Clients. Statement of Purpose. The purpose of this unit is to examine physical changes, developmental needs, and common disease processes found in the home health care client. The impact of illness on the client's and family's physical, emotional, and psychological health is also examined. The importance of client and family rights and privacy are emphasized. Effects of terminal illness on the family unit and the role of the HHA in providing a caring and supportive environment are discussed. Performance Standards, Objectives. Upon completion of 5 hours of class plus assignments, the learner will be able to define the terminology, identify the basic physical and emotional needs of clients in each age group in the lifespan, recognize the role of HHA in maintaining client and family rights and privacy, relate client and family rights to Maslow's hierarchy of needs, discuss how culture, lifestyle, and life experiences of the client and family can influence care provided, describe common reactions to illness or disability and its effect on the individual and family, including techniques to support adjustment. Describe basic body functions and changes that should be reported. Identify diseases and disorders common in the home care client and their signs and symptoms. Describe common emotional and spiritual needs of terminally ill clients and their families and identify appropriate interventions. Terminology. Learner activities or assignments. Group discussion. HHA services for clients of various age groups and how the HHA might provide for them. Role-play a situation where an HHA's favorite client states to the HHA that he or she wants a new caregiver. Role-play situations where client and family customs, religion, and/or culture affect client care. Group activity. Have students write the 5 most important things in their life on 5 different pieces of paper. Then, in the process of describing grief and loss, ask them to give up one important thing at a time and take the pieces of paper from them. Monitor their feelings of loss as they identify with clients who have lost body parts or the use of limbs. Teamwork exercises. How would an HHA deal with a client who is using an alternative therapy? Role-play a situation where a client does not know his terminal diagnosis. Teaching strategies. Classroom lecture and discussion. Handouts for patients' rights and responsibilities and developmental stages. Role-playing. Group exercises or activities. Content Outline, Section 1, The Terminology. Review the terminology below. Section 2, The Basic Physical and Emotional Needs of Clients in each age group in the lifespan. Handout, A Summary of Developmental Stages. A. Infant. Normal development, rapid growth, and gradual control of movement. Physical and emotional needs. Total care of physical needs. Bonding and human relationships are very important. B. Toddler and preschool. Normal development, walking and development of motor skills. Physical and emotional needs. Can perform some self-care skills. Needs coaching. Wants to be independent, but needs supervision and security. General interventions for infants and children. Maintain a routine. consistent guidance and discipline. Treat the child as an individual and listen attentively. Use positive suggestion. Comfort a child who is hurt or upset. Answer questions simply and directly. Avoid false reassurance. Encourage play and activities. C. School age. Normal development. Physically active and enjoys learning. Physical and emotional needs. Growth spurts, relationships, and influence of peers. D. Adolescence. Normal development. Puberty. Achieves adult size. Believes they are invincible and immortal. Developing self-identity. Physical and emotional needs. Wants to be treated as an adult. Relationships are important. General interventions. Maintain communication and listen attentively. Provide privacy. Foster independence. Provide reassurance and support. Show respect for the individual as a person. Respect their importance of peers and their relationships. Include the client in planning of their care. E. Early adulthood. Normal development. Establishing a career. Marriage. Establishing a family or home. Physical and emotional needs. Develop good health habits. Establish a relationship with their spouse. General interventions for adults. Promote independence. Provide privacy. Support their relationship with their family. Provide for home stability. F. Middle adulthood. Normal development. Involved with raising their family. Productive in their career. Physical and emotional needs. Maintain healthy lifestyle. And security for later years. G. Late adulthood. Refer to the physical and psychological changes of aging. NATAP or DHS Module 13. Section 3. The role of the HHA in maintaining client and family rights and privacy. The HHA is accountable for knowing and protecting all the rights of home care clients. The rights of the home care client include the following categories: dignity and respect, decision-making, privacy, financial information, and quality of care. Handout, National Association for Home Care, a model, Patient Rights and Responsibilities, page 42, for in-depth review of client rights. Section 4. Clients and families' rights and privacy to Maslow's hierarchy of needs. A. The clients and families' rights include basic needs, security, including protection of funds, respect for personal items, stability in scheduling and personnel, access to emergency telephone numbers and agency numbers. Belonging, inclusion of family and significant others, respect of client's significant other, participation in the development and interpretation of the plan of care. To receive sufficient data and to make informed decisions. Self-esteem, privacy and confidentiality, participation in the development and implementation of the plan of care, respect of the client's preferences, and personal recognition and acceptance. Section 5. How culture, lifestyle, and family experiences of a client and family can influence care provided. A. Family units. Individuals who live together, usually related by blood or marriage. B. How they differ. Variation in family units. Ages, roles, and relationships. Culture. Values, beliefs, and customs within a society. Different cultures. Effect of culture on the family unit. Effects of customs on health practices. Religions. Different types. Effects of customs on health practices, like clothing, hygiene, ceremonies, and diet. Life experiences. Ethnicity. Economic status. C. How differences can change responses to illness or disability. Variables that can affect response. The seriousness of the illness, the length of the illness, the expected outcome, other family members who may have the illness, differences in individuals' response to the illness, interests, likes, and dislikes, temperament or disposition, physical and mental capabilities, goals and values. D. Support individual and family customs, differences, and preferences. Report practices that may be harmful to the client or family. Section 6. Common reactions to illness or disability and its effects on the individual and family, including techniques to support adjustment. A. Common reactions of individuals to illness or disability. Denial, resentment, anger, impatience, depression, grief or loss, dependency, fear, and acceptance. B. Common reactions of the caregiver or family to illness or disability. Resentment, which can lead to abuse. Frustration, which can also lead to abuse. Becoming overprotective. C. Factors that influence reactions. Previous experiences with their own or another's illness or disability. Impact on lifestyle, developmental age, and coping mechanisms. D. Common effects of illness. Acute versus chronic. Physical, role, social, financial. E. Individual and family adjustments to illness or disability. Controlling symptoms. Adjusting to the course of the disease, downward or a plateau. Allowing time for care, i.e. diabetic testing, colostomy irrigation. Preventing crisis, with a medical alert bracelet, emergency telephone numbers. Maintaining social contacts, when there is reduced mobility, a feeling of not being socially acceptable. Coping with financial impact, such as their inability to work and the cost of medical care. Maintaining their lifestyle. F. Strategies the home health aide can use to help individuals and families cope. Encourage and support individuals and family members. Perform supportive tasks. Encourage socialization. Use positive reinforcement and focus on the self-worth of the individual. Avoid false reassurances. Allow individuals to express their feelings without being judgmental. The home health aide should not tell the client or family what they should do or feel. Section 7. Basic body functions and changes that should be reported. Review Body Systems and Functions, NATAP or DHS Module 13. Review Signs and Symptoms to Report, NATAP or DHS Modules 4 and 12. Section 8. Disease and disorders in the home care client and their signs and symptoms. Common conditions in different age groups. Infants and toddlers. Congenital conditions. Cystic fibrosis. Signs and symptoms. Respiratory difficulty. Digestive disorders. Cerebral palsy. Signs and symptoms: tremor. Uncontrolled muscle movements. Prematurity. Signs and symptoms: the small size, little body fat, temperature and breathing problems. Down's syndrome. Signs and symptoms: slow development, characteristic appearance. Fetal alcohol or drug syndrome. Signs and symptoms: irritability, a short attention span. Heart conditions. Signs and symptoms: fatigue and cyanosis. Respiratory conditions. Asthma. Signs and symptoms: wheezing, shortness of breath, fatigue. Pneumonia. Signs and symptoms: fatigue, cough, fever. Infectious diseases, such as chickenpox or impetigo. Signs and symptoms: rash, swelling, warmth. Childhood and adolescence. Head and spinal injuries. Signs and symptoms: loss of function. Malignancies such as leukemia. Signs and symptoms: fatigue, changes in body functions, bleeding or pain. Diabetes. Signs and symptoms: frequent urination, thirst, increased appetite, weight loss, and fatigue. Adulthood. Multiple sclerosis. Signs and symptoms: weakness, loss of coordination and balance, blurred vision. Rheumatoid arthritis. Signs and symptoms: joint pain, swelling of joints, fatigue. Postpartum. Signs and symptoms: weakness, surgical incisions. Post-surgical. Signs and symptoms: weakness and surgical incisions. The elderly. urinary tract infections, upper respiratory infections, accidents. Review the needs and changes in the elderly, disorders of the elderly, NATAP Unit 14, or DHS Module 13. Section 9. Common emotional and spiritual needs of terminally ill clients and their families, and identify appropriate interventions. Review Death and Dying, NATAP or DHS Module 16. Terminal illness. Understanding family systems. Impact of illness on family. Reaction of community to illness. Impact of community's reaction on patient or family. Expectation of patient or family regarding treatment outcomes. Review the Kubler-Ross stages. Denial, anger, bargaining, depression, and acceptance. How to respond to the different stages. Understanding the emotional needs of the patient. Need to be normal. Need for meaningful relations. Need for love. Need for recreation. Need for safety and security. Special fears and anxieties. Caring for the emotional needs of the dying patient. Communication skills. Listen attentively. Honesty. Hope. Concern and acceptance. Support and comfort. Special communications of the dying patient. Common themes. Caring for the physical needs of the dying patient. Offer opportunities for independence in care. Offer assistance as needed. Differentiate between necessary and optional care for the dying patient. Comfort care measures. Special needs of the family. Reassurance. Self-care for the caregiver. Acceptance of feelings. Need for support system. Dealing with minor children. Dealing with conflict. Home care considerations. Flexible routine to accommodate family. Protect privacy and promote independence. Encourage verbalization. Encourage family participation. Resources. Social workers. Clergy. Hospice. Bereavement support. Postmortem care. Refer to postmortem care, NATAP Unit 15, or DHS Module 16. Closure for the home health aide. Support groups or services. Attendance of funeral. Handout. A summary of developmental stages, including Erickson's stages. Infancy. Trust versus mistrust. From birth to approximately 18 months. This stage is the most significant psychosocial stage. The quality of the relationship between the infant and the primary caretaker is important. When primary needs for food, warmth, and sleep are met, a sense of love, security, and trust begins. Physical changes. The baby first learns to control their head, then mid-body, then arms and legs, then hands and feet, then fingers and toes. Goes from being totally dependent to walking. Toddlers. Autonomy versus shame and doubt. Approximately 18 months to 3 years. With trust, the infant can now discover his own behavior. The toddler becomes assertive and wants to explore himself and his environment. Physical changes. The child is able to walk and reach and is into everything. Child is curious and wants to feel and taste things. Preschool age. Initiative versus guilt. Approximately 3 to 6 years. Language and good locomotion gives the youngster its ability to expand the imagination. The development of conscience begins. Physical changes. Fine motor skills develop. Begins to hold and use crayons and pencils. Scribbling progresses. Child is able to help dress themselves and wash their face and hands. They become aware of their sexual organs. School age. Industry versus inferiority. Approximately 6 to 12 years. The school child begins to differentiate between work and play. He learns to enjoy his work for the pleasure he gains from it. Need for acceptance by peers. Physical changes. The child learns to write, hop, draw, skip, dance, and to make things with their own hands. The adolescent stages. Identify versus diffusion. Approximately 12 to 20 years. The adolescent is learning about who he is, where he wants to go, and what he wishes to do with his life. Withdrawal from family begins. Physical changes include physical growth, weight increases, muscles and bones change, and sexual characteristics develop. The young adult stage, intimacy versus isolation, approximately 20 to 40 years. The young adult is concerned with establishing sexual intimacy, which is usually centered around marriage. Final career choices become important. Physical changes, attains adult stature and development. Generally healthy and physical abilities are good. Adulthood, generativity versus stagnation, approximately 40 to 60 years. The concern in middle adulthood is contributing something of lasting value to youth and the society. Adjusting to change in sexual activity becomes important. Physical changes, decrease in metabolism with age and physical activity, changes in vision and hearing, wrinkles and graying. Senescence, integrity versus despair, approximately 60 years and older. Accepting one's life for what it was and enjoying what has been promotes integrity. Feeling useful and enjoying respect are important. Physical changes, loss of height, a decline in muscle mass, superficial body fat, decline in overall body functions. Handout, patient rights and responsibilities. As a patient, you have the right to be treated with respect, consideration, and full recognition of dignity and individuality, including privacy in treatment, care for personal needs, and respect for property. To be free from mental, physical, sexual, and verbal abuse, neglect, and exploitation. To be informed of your rights in a manner that you understand. To exercise your rights to voice grievances regarding services, care of treatment without fear of reprisal, discrimination or unreasonable interruption of care of services. Have a family or guardian exercise your patient rights if you have been judged incompetent. Be fully informed of services available from the agency under the terms of Medicare, Medi-Cal, and/or insurance. To be informed in advance about the care to be furnished and any costs you may incur. To receive care by personnel that are fully qualified to perform the functions for which they are employed. To participate in the planning of your care or treatment and planning changes in your care or treatment. To be fully informed by your physician, unless medically contraindicated, of your illness, additional diagnosis, and prognosis. To be taught about your illness so that you and your family can make informed decisions and help in recovery and care. To refuse treatment, care, or services at any time, and to be informed of the consequences of that refusal. To choose whether or not to participate in research, investigational, experimental studies, or chemical trials. To be assured of confidentiality in treatment of personal and medical records, and to approve or refuse the records release to individuals outside Marshall Home Care, except in the case of transfer to another health facility, for the continuation of care as required by law or for third-party payment contracts. To formulate an advance directive and to have practitioners who provide care comply with those directives. Appropriate assessment and management of pain. Have communication needs met in a language or form understandable to you. To remain under a doctor's care while receiving agency services. To provide the agency with complete and accurate health information and to report any unexpected changes to the patient's condition. To sign the required consents prior to care being given or received. To ask questions about care or services if you need further understanding or clarification. To treat agency staff and other personnel with respect and consideration. To notify the agency when you cannot keep appointments. To accept the consequences of refusal of treatment or choice of noncompliance. To participate in the planning of your care. To provide a safe environment for the agency staff. To provide the agency with a copy of advanced directives, if applicable. To meet financial commitments by promptly meeting any financial obligation agreed upon with the organization. The Department of Health Services maintains a toll-free number for questions or concerns regarding home health agencies or to lodge complaints concerning the implementation of the advanced directive requirement. You may contact the Department of Health Services 24 hours a day, 7 days a week at 1-800-554-0354. You will not be subject to any reprisals or discrimination. Learning activity: family customs, religion, culture, and client care. Group exercise. The following scenarios may be role-played or used as discussion items for the whole class for the purpose of exploring the home health aide's attitudes, roles, and responsibility in caring for clients with varying family situations and cultural backgrounds. While the home health aide is caring for an elderly client in her home, the client's daughter arrives. Seeing that her mother is requiring some assistance with personal care, the daughter makes the statement that, "This can't go on. I'm going to put my mother in a nursing home where she will get proper care." Although the client says nothing in response at the time, after the daughter has left the home, the client tells the home health aide that she is not willing to go to a nursing facility and that if she is going to die, she wants to die at home. A Spanish-speaking family has arranged for a home health aide to assist the elderly grandmother after a recent hospitalization. When the home health aide arrives at home, the elderly woman asks the aide prepare a medicinal tea that her curandera, or medicine healer, has brought to help her get well. In a home visit to assist an elderly woman who is severely crippled with arthritis, the home health aide notices that the school-age grandson who lives in the same house has 2 large burns on his chest. When the home health aide asks what happened, the grandmother states that the father put fire on his son's chest to drive out the evil spirit which is making the grandson sick. The home health aide is assigned to provide care to a home care client who has recently been discharged from the hospital following surgery. The client is 40 years old and is developmentally disabled with a functioning level of about 8 years of age. He lives with his aging mother who has congestive heart failure and is blind.